Oxcarbazepine Tablet, extended release 24 hours is a medication used in combination with other drugs to control and prevent seizures in people with epilepsy. It helps to reduce the frequency and severity of seizures. The usual dosage varies depending on the individual's condition, but it is typically taken once or twice daily. It is important to take this medication at the same time each day to maintain a consistent level in the bloodstream. Be sure to follow your doctor's instructions carefully for the best results. Before taking oxcarbazepine, make sure to read the medication guide provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Take this medication by mouth on an empty stomach, usually once daily. Swallow the extended-release tablet whole, and do not crush or chew it. The dosage is based on your medical condition, response to treatment, and other medications you may be taking, and for children, it is also based on weight. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Use this medication regularly to get the most benefit from it, and take it at the same time each day to help you remember. Do not stop taking this medication without consulting your doctor, as some conditions, such as seizures, may become worse when this drug is suddenly stopped. Remember to tell your doctor if seizures worsen. If you experience dizziness, drowsiness, tiredness, nausea, vomiting, or headache, make sure to inform your doctor or pharmacist. Remember, this medication has been prescribed to you because the benefit is greater than the risk of side effects for you. Many people using this medication do not have serious side effects. Some people who take anticonvulsants may experience depression, suicidal thoughts/attempts, or other mental/mood problems. If you or your family/caregiver notice any unusual/sudden changes in your mood, thoughts, or behavior, including signs of depression, make sure to tell your doctor right away. If you experience any serious side effects, such as loss of coordination, vision changes, shaking, easy bleeding/bruising, or unusual tiredness, inform your doctor immediately. Also, seek medical help right away if you have signs of infection or symptoms of low sodium level, or if you develop any skin rash, blisters, peeling, itching, or swelling. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects not listed. Before taking oxcarbazepine, make sure to inform your doctor or pharmacist about any allergies you may have, especially to anti-seizure medications. It's important to discuss your medical history, especially if you have kidney disease or low sodium levels. This medication may cause dizziness or drowsiness, so avoid alcohol or marijuana while taking it. It's also important to inform your doctor about all the products you use before having surgery. If you are pregnant or planning to become pregnant, discuss the benefits and risks of using this medication with your doctor. It's also important to consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions with oxcarbazepine. This medication can affect how other drugs work in your body, including medications like cabotegravir, cobicistat, elvitegravir, sofosbuvir, and rilpivirine. It can also decrease the effectiveness of hormonal birth control, so it's important to discuss using additional reliable birth control methods with your doctor. Additionally, oxcarbazepine may interact with products that cause drowsiness, such as alcohol, marijuana, antihistamines, and opioid pain relievers. It's important to check the labels on all your medicines for ingredients that cause drowsiness and to ask your pharmacist about using these products safely. And remember, oxcarbazepine should not be used with medications containing eslicarbazepine. If you or someone you know has taken too much oxcarbazepine tablet, extended release 24 hours and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Remember, it's important not to share this medication with others. Your doctor may also want to monitor your sodium levels and complete blood count while you are taking this medication, so be sure to keep all of your medical and lab appointments. Consult your doctor for more details regarding the benefits, daily dosage, and the best time to take this medication. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. Make sure to store your Oxcarbazepine tablet, extended release 24 hours at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from the reach of children and pets. When it comes to getting rid of this medication, be sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.